Thank you, Lois. I'm Art Hengerer. I'm a burned-out otolaryngologist. And as a result of that, ended up in the regulatory aspects of healthcare, and why I stand before you today. I chair a medical conduct board for a state which disciplines physicians, and I also have just finished being the chair of the Federation of State Medical Boards, and understand really the importance of the regulatory aspect and the stigma that we can create and the burnout issues that result from that. So I'm passionate about and thankful to be involved in this because it is so important. And as we began this whole process that Dr. Nora just outlined for you, we really did begin with looking at multiple conceptual models that existed out there and what were the important points that came from them and where did we see needs to change. So we are really happy to be here today to share with you how far this group that was just identified has gotten with what we've developed, but it's such a dynamic effort that's going on, and we want to hear from you the flaws we have in it. And one of the big areas that we have really struggled with is who's in the center of this model. This is the one that we got to recently as a group, and I'm going to share with you in a second the newest, latest model with the help of designers that I think has simplified. But what we struggle with is it the patient that's at the center of this, or is it the clinician that's the center of this? Or where do these come together? And also, what are all these different aspects that we've been hearing about this morning that make up burnout and the problem that we're dealing with? So this is where we've gotten to at this point, and it begins to answer some of that question about the clinician and the patient and where do they fit into this. How does this impact on the well-being of the clinician and the healthcare provider? And the other point that came up that went way back to the very beginning was that there's external factors that play into this, and then there's the individual factors that play into this, and then there's the learning and work environment. These were the three things that Dr. Kirsch brought to the group way back at the beginning of the three main areas that he envisioned that we ought to be thinking about, and our group has kind of tried to focus on that. And the other focus we're trying to come to grips with is we realize that the external factors play a bigger part than the individual factors. How do we demonstrate that in the model that we're trying to create? And but this is where we've gotten to at this point. These are the 8 different topics that we see that really are critical to be looked at, a number of the individual things under each one of those topics that we've come to, and this will continue to grow and evolve, and your help today will help give us some direction on where we're going to take that. So the other thing is we've been very descriptive in this, in just what's bringing this problem on, but what we haven't decided yet as a group, do we need a second model that will look at some of these interventions that are going to go on to deal with this, and how do we incorporate and put all this into a proper perspective? Because what we think we are going to be doing for this whole collaborative effort is this is going to be the thing that's going to be sitting out there that we, as those who are the healthcare providers and those in the public, are going to need to be seen and need to be able to understand this, because it will be that foundation that the research group, the communication group, and others are going to have to use to share as we move forward. So thank you very much.